Hi, my name is Amber Tackett, and this is my assignment for N110 or Foundations of Nursing Practice for Aspen University. And this is my SBAR scenario and questionnaire. So if you see me looking up, sorry, that's me looking at the screen of the scenario. So the scenario that I chose was scenario number 3, and it states Margie Colby, a 25-year-old Primipara is in the recovery room after a low forceps delivery of a 9-pound, 2-ounce term male. Although this was an unplanned pregnancy, Margie and her husband adjusted to the idea and are now very excited parents. Margie plans to breastfeed the baby. 45 minutes after delivery, her vital signs are blood pressure of 100/60, pulse is 88, and respirations are 16. Her fundus is firm and at the level of umbilicus, and no clots are observed. She has continuous trickle of bright red lochia, no change in perineal edema, ice pack applied, and peri-pads were changed. Peri-pads and Chuck's weight indicate about 300 cc's of blood loss. 15 minutes after that, the fundus is massaged and remains firm at the umbilical level and midline. A constant trickle of bright red lochia still persists with no clots being expressed. Peri-pads and Chuck's weighted, showing an additional 200 cc blood loss. Vitals are now BP is 90/52, pulse is 110, and respirations are 20. So the first question is, what are your thoughts on the clinical scenario? My first thought was that there should be some sort of red flag automatically for these nurses to see that her baby was born heavier than the average baby, and also that the baby was born by forceps. So that usually means there was some kind of complication or something going wrong, or some kind of issue during the birth. So there is an increased risk for postpartum hemorrhage in cases like this, in both things, the baby being big as well as the use of forceps for the delivery. So that should be closely monitored for a while anyway. In the end of the scenario, it shows the signs of shock with the low BP, high pulse rate. So that should be another huge red flag. And she seems to have lost quite a bit of blood, but the overall scenario doesn't seem super urgent. And according to Management of Postpartum Hemorrhage, a research article that was posted back in 2014, about 500 cc's of blood loss for vaginal births are considered hemorrhagic. And considering that was her within the first hour after her birth is a major red flag, and should have been monitored very closely. The next question, what do you think could have been added to the SBAR? I think this person was missing quite a bit of information, and some things were thrown in there that probably didn't need to be. I believe a list of her medications should be added, be it whatever she takes at home, over the counter, prescribed, whatever, as well as any medication she was given during her hospital stay, IV saline or Pitocin or anything else that she was given, because that could also be a concern for her increased risk for hemorrhagic bleeding postpartum, such as if she's on like blood thinners or anything like that. So those should definitely be noted, as well as it needed to be elaborated a bit more on her whole laboring process, like how long she was in labor for, why they ended up needing to use forceps, if there was any issues, with tearing, or if the placenta was delivered normally, or if there's any complications with that. Also information regarding previous pregnancies. I know it said primipara, but I would also like to know if there was any previous pregnancies, if she has any gravidity, I think is how you say that, if she's gravid 1, or if this was her first pregnancy and whatnot. That would be good to know. Also, I think more vital signs should have been included, such as if she had a fever, her O2 levels would be really good to know, especially since she's going into shock, and also to assess her pain level, both at that 45-minute mark originally and then that 15 minutes later. It seems like that could have really changed between that 15 minutes. Basically, the nurse's assessment overall should be noted, like what the nurse thinks is going on, what they think is wrong, and also any interventions or recommendations that they would have for the provider. That would be super helpful to put in there. And that's kind of but the A and the R part of an SBAR is assessment and recommendations. So that definitely should have been put in there. The next question is, what do you think we did not need in the SBAR? I don't think the comment about the pregnancy being unplanned and their excitement overall should be included. While that is great that they are excited, but I don't really think it's pertinent to medical data that the provider wouldn't necessarily need for this really urgent case to take the best care of the mother and child. I do think the plans for breastfeeding could be hit or miss, just in the case, like I've heard, I did not completely research it. I didn't see any concrete information from any scholarly websites anyway, that breastfeeding helps reduce postpartum bleeding. I've heard that that's true, but I'm not 100%. So the breastfeeding is hit or miss, I feel like, in this situation, especially since it says she's plans to. I don't know if she has even done so yet. So like I said, this kind of hit or miss, kind of depends. Like I said, if I could have found something more concrete about that fact, I probably would have thrown that in there. And then the next question, if we did this conversation again, what should we do differently? I would definitely leave out the unplanned pregnancy aspect because, like I said, that's not really key information that the provider needs at this point. I'd also lead with critical information, such as her most recent vital signs and her blood loss. Those are two huge things that the provider needs to know right here, right now, because those are quite significant. And there's other great information in this scenario. However, the vitals and the immediate stuff need to be noted first, and then everything else can kind of be go from that, such as the trickle of lochia, the firmness of the uterus, and all of that, like I said, are very important, but it's not as vital as the actual vitals and the significant amount of blood loss that this patient is experiencing. And I would also, again, make this just seem more urgent, because this seems like it wasn't very urgent to the nurse, especially with the 300 cc's of loss just in that first 45 minutes. It should have triggered the nurse to at least warn the physician, like, hey, there's a lot of blood loss already going on. I'll keep you updated, at least, so they had a little bit more time to prepare, or at least start coming up with some kind of plan for the patient if need be. And then at least it's easier to cancel, tests or other medications rather than having to do everything super fast because the patient is critically falling. So yeah, I would just definitely make them more urgent and put the more important information first, especially, like I said, since she's showing signs of shock, I wouldn't be telling the provider about their excitement for the baby. I mean, again, it's great, but it's not super critical in this portion of the report, I guess. And last question, do you think the significance of the situation was clearly presented to the physician? Honestly, like I said, I would have made a way bigger deal out of it. I don't know if I'm just over reacting, I guess. I know it's a critical patient, but again, I would just definitely lead with those critical aspects of the entire scenario first. I just kind of am repeating myself. It needs to be more critical, because again, it's a lot to handle. It's a lot that can go wrong really, really fast and should have been addressed way sooner. Also, the interventions needed to be suggested again to the provider. Like, hey, we did do the ice packs like it said in there and change the peri pads. But again, there also should have been note of if any IV medications were given or any medications that she's on in general, because those seem way more urgent, again, than some of the other pieces of information. So no, I don't think the significance was really pushed to the physician. It seems like such a casual report, because again, it just starts off so smooth, like, oh, they're so excited now, it was unplanned, but that's just not something you lead with for such a critical patient, in my opinion. And I don't even think it's an opinion. I think that's just definitely what needs to be addressed first. Again, and I think I mentioned it earlier, that first 45 minutes with a 300 cc's of blood loss definitely needed to be concerning for the nurse, and again, reported urgently to the provider. So again, they could try and prepare for the tank that she's going through at the end of the report. So maybe if, they could have had more things ready for at that 15-minute check than later on. But yeah, so that first 45 minutes, like I said, should have been addressed. Definitely should have been more significant, so it wouldn't just now be being presented to the physician or provider in general. All that information is very critical, and there's a lot of risk factors that this patient had to begin with. And like I said, that 300 cc's, it's almost to 500, and that's only in the first 45 minutes, so that's definitely a huge red flag, and the significance definitely need to be presented better to the physician, in my opinion. But that's all the questions. I hope you guys enjoyed, and I hope you guys learned something. And thanks for watching. Bye.